Hello, I'm Dr. Laura Murillo, President and CEO of the Houston Hispanic Chamber of Commerce. Joining us today is none other than Dr. Kenneth Ramos. He is the Assistant Vice Chancellor for Health Services, Texas A&M University System. Welcome, Dr. Ramos.
Thank you so much, Dr. Murillo.
Thank you. And we really appreciate your engagement with us here at the Chamber of Commerce. It's so important that we continue to highlight professionals such as yourself doing incredible work, not just here locally, but globally. And so we look forward to learning more about your work.
Precision medicine is a platform for healthcare delivery that's increasingly being used in hospitals throughout the nation to improve the quality of care. Obviously, there's deficiencies in the system that give rise to problems that one could actually begin to address, taking advantage of novel technology. And so the premise behind precision medicine and what's advancing right now is taking advantage of all of these technological advances, both in DNA technology, digital technology, artificial intelligence, machine learning, and integrating all of those concepts in ways that enable you to make better diagnosis, better treatment decisions, and ultimately prevent disease in ways that give rise to improved quality of health throughout society.
Embracing all of this, as you mentioned, artificial intelligence and technology, and finding ways to enhance and improve the patient experience.
Absolutely. And in the context of our work in Houston, we're particularly focused on health disparities and the idea that there's communities and individuals that are not well poised to be able to take advantage of these technologies. And so we're working very aggressively to make sure that Hispanics can actually begin to get involved in this precision era of medical care delivery. Up until now, the disappointing fact is that Hispanics have not been engaged in a very meaningful way, and that's one of the areas that we're very interested in making sure that we correct.
Yes. And tell us a little bit about the biomedical and clinical program specifically. What does this mean for, patients?
The areas of focus for the programs that we are involved in basically get sort of clustered into four major domains. One of them focuses on disease prevention, taking advantage of genetic technology, and particularly sort of food as medicine. The concept that good quality diets actually help improve quality of health. A second sort of cluster of activity focuses on infectious diseases, much like what we went through with COVID, viruses as well as bacteria, sepsis, and that type of problem. And then we focus a lot on inflammation, which, as you know, is a major root cause of many of the disorders that affect, populations, including Hispanics. The third area of interest is cancer, where we do a lot of work, primarily trying to identify new medicines and medications that can actually be specifically targeted to specific conditions. And then the last piece focuses a lot on DNA technology and the use of DNA technology to either stratify populations and identify individuals that may be at risk of disease. And then with this information in hand, then of course, put in place interventions that can actually help correct those problems.
So along with all of this work that you are doing, I know that you recently edited some research, some work, a report on precision medicine, a series. Tell us about that and what is the impact it will have globally?
The series, actually, the background that you see in this image is the front cover of the book. It's kind of showing you how computerized machine learning actually can be used to improve the quality of care. And so this is a series that basically has 7 sections attached to it. It's comprehensive in that it covers the full span of the field, beginning with DNA-based technologies, focusing on clinical interventions that we currently have that can be taken advantage of in a precision type approach, looks at actual social determinants of health and non-medical determinants of health, which, as you know, is a very important aspect of health that has, in fact, not being properly integrated into patient care. Another section that focuses on artificial intelligence and machine learning and all of the advances that actually will turn medicine around in ways that improve quality of care. And then last but not least, we're focusing also on prevention. How do you take advantage of the knowledge that you have to, rather than treat a disease, prevent that disease from actually occurring? So we're very excited about it. It's the global outreach of this series is that the book's been published everywhere in the world and being read by populations that normally probably would not have access to this type of information.
So exciting, really impactful work that you and the team are doing. We appreciate your involvement with the chamber. And before we wrap up, is there anything else you'd like to end with?
Just a big thank you to you and the leadership that you provide for the Hispanic community. I'm delighted to have a chance to interact with you and look forward to continued interactions.
Well, we're very proud of the work that you are doing, and it is thrilling to see the advancements that you and your team are making, not just here in Houston, but again, as mentioned, globally. Have a great day.
You as well.